Former President George W. Bush is recovering today from heart surgery. A spokesman says he's doing well with no complications after doctors discovered a blockage in one of his arteries yesterday. Doctors at the Cooper Clinic in Dallas opened the blockage in a procedure this morning by inserting a stent into the artery. The former president is said to be feeling good and is looking forward to going home tomorrow. The blockage was discovered during Mr. Bush's annual physical examination. And joining us now to talk more about the procedure for the former president is Dr. Paul Tolerico, a cardiologist from WellSpan. First, talk about the procedure itself. Exactly what is the stent and why was it necessary?
Well, the procedure has become fairly routine, and what occurs is we insert a small catheter, a small tube, in through an artery, usually either in the groin or in the wrist, up to the heart, and we can take pictures of the heart arteries and identify blockages. The placement of a stent is done over a small wire. And the stent is attached to a catheter. It's blown up inside, as we can see on the monitor here, inside the blood vessel, and basically pushes the blockage out of the way. And then the balloon and wire equipment are removed, and it provides a scaffolding to support open the artery at the site where the blockage had been.
And that's a small piece of mesh metal that's left behind. He had the procedure yesterday, or they found he needed the procedure yesterday, had the procedure done right away. Is that common, or is that something that's that quickly because he's a former president?
Well, in an emergency situation, someone who presents with symptoms, especially if they come to the hospital through the emergency room or come to a doctor's office and are felt to be potentially quite ill, it can be done fairly quickly, right away, really. In fact, in the setting of a heart attack, our goal is to have the patients taken care of and fixed within under 90 minutes.
Now, they found I'm sorry, go ahead.
But in his case, it's difficult to say. More routinely, it's scheduled a little more electively than that, and I suspect he might have connections that got him to the front of the line.
Now, one stent so far, there are other arteries. Does this typically mean that there will probably be blockages in other arteries that they'll be looking and possibly need more stents?
It typically does mean that to some extent. The area of blockage that requires a stent is a more severe area of blockage or plaque. Atherosclerosis is the medical term, but that's usually a diffuse process that's present all throughout the arteries. Some spots worse than others. It doesn't necessarily mean he'll need another stent at any time in the near future, but he'll need to be treated aggressively to try to prevent that from happening by controlling blood pressure, cholesterol levels, diabetes, not smoking, other factors that you can control.
If I were to come see you, how would you find, if I needed that or somebody who's watching, how do you find the need for those stents?
Most often, patients will present with symptoms that suggest potentially heart problems, things like pain, pressure, or tightness in the chest, trouble breathing, perhaps. Another thing that may occur is the patient may have a stress test where they come in and they may walk on a treadmill or be given a medication to stimulate the heart that will then identify blood flow problems, and then that will lead to the catheterization procedure and subsequently the identification of a blockage that needs a stent.
Now, you brought in a couple of them. I'm sure we have them here on the piece of paper. I don't know if you can see them zoomed in. A couple of examples of the stents right here. Talk about what they're made of. And once these are in place, do they need to be replaced at some point, or is this pretty much permanent?
Well, the stents are made of metal, originally stainless steel years ago, but now they've evolved into more the high-tech metals, nickel, titanium, platinum, things along those lines. These stents are actually bigger than what you would find in a heart. These are more vascular stents for blockage in the kidneys and legs. They are permanent once they're implanted. One thing that's a little exciting in my field is we're actually involved in a trial at York Hospital where we're looking at the next generation of stents that will dissolve over time, and in about 2 years they'll be gone from the artery and leave you back with your artery that you were born with, and take that foreign body out of the system.
All right, well, doctor, we appreciate your insight, and I'm always amazed how you can come in on one day, have heart surgery, and go home the next. It's pretty fascinating.